Cancers of the blood are life-threatening diseases that affect thousands of people every year. Finding the right treatment for these illnesses can be difficult for those affected, but now a group of clinical researchers say they have an idea that could help. It's a simple, free app called ClinTrial Refer. A haematologist at Concord Hospital was one of the app's creators.
ClinTrial Refer is a smartphone app, so it's available on iPhones or any Android app or an iPad even, and it's a simple means of being able to search through and identify the currently recruiting clinical trials across the haematology centres in New South Wales.
Clinical trials allow patients low-cost access to treatments which are not yet approved by the Australian government. Drug companies fund these drug trials, and they have a good reason.
Basically, all the treatments that we give patients for blood cancers, say lymphoma, which is a cancer of the lymph nodes, the lymph glands that we find throughout our body, those treatments are only approved to be given and funded for by the Australian government if clinical research has demonstrated that that drug is actually effective. Before we launched the app, less than 3 patients a month were being referred from hospital to hospital for screening for participation in clinical trials. But with the app, with such better knowledge management and easily identified trials and trial locations, that has exploded. And at the moment we're averaging about 15 patients per month being referred for consideration for trials participation.
Michael Van Uwick is one such patient. His doctor used the app to refer him to a clinical trial for a drug that has already been approved in the United States.
Look, I was diagnosed in 2005 with Waldenstrom macroglobulinemia, which even my GP hadn't heard of it. So it was a bit of a bolt out of the blue. Very rare cancer, 1 out of 5 in a million apparently get it. But look, the problem is that there's very few drugs that are available to Waldenstrom patients, and the usually ones that have been side ones like that have been used on other cancers. There's nothing ever been approved for Waldenstrom here.
ClinTrial Refer has been well received by the medical community, with the app winning the New South Wales Premier's Award for Outstanding Cancer Research. Haematologist Alessandra Bianchi is one practitioner who has jumped on board.
The ClinTrial Refer app has been a fantastic resource, because one of the difficulties with doctors, especially working in the cancer setting, but not only the cancer setting, is that you have got some clinical trials that are going on at your hospital, but you clearly cannot have clinical trials open for all the drugs that are being trialed. So it's the easiest way to look at a particular disease and to find out where in your city there might be an open trial that suits your patient.
Clinical trials can be risky business for patients, as the effect of the administered drug is not yet fully known. The full extent of the drug's safety and effectiveness is often unclear. However, clinical trials still play an important role in the treatment of diseases.
These are often patients who have failed other more common treatments, and so you have got very little choice, and the clinical trials offer chances that they would not otherwise have. And remember that these substances, these drugs, they are not yet available for the public, so it's only in the context of a clinical trial that you can access the drug.